Good afternoon, everybody. Welcome to the 2025 Annual Nursing Theory Conference. My name is Florence Nightingale, and I'm going to be presenting my environmental theory. So to start with, I'm just going to give a brief overview of the theory. It is considered a grand nursing theory based on human needs. It covers a broad scope and very useful in today's practice, and I am considered the founder of the basis of modern nursing. Talking a little bit about my early life, I was born May 12, 1820 in Florence, Italy, into a wealthy aristocratic family. I was educated by my father in math, philosophy, and language, and began ministering to the poor and ill when I was about age 16. Nursing at the time was considered a lowly for a wealthy woman, and it wasn't a respectable profession. My family, however, eventually encouraged me to pursue my goal of becoming a nurse, and I got my first job in 1853 as superintendent of a hospital for invalid gentlewomen in London. Shortly after that, the Crimean War broke out in 1854, and I was appointed by Secretary of War at the time to take a group of nurses to care for our British soldiers in Turkey. There we witnessed deplorable conditions in which our soldiers were living. The wounded lay in filthy surroundings over sewers. There was an extreme lack of food and basic supplies, military mismanagement of the supplies, and a very high mortality rate. And I and my team of nurses were determined to make a change in this situation. So we were touched by the conditions of our soldiers, and we began to implement changes. My theory teaches taught cleanliness among the wounded, and I also extended these teachings to the homes in the community, which today can be considered as public health. I frequently made rounds at night, taking care of the sick, and thus was dubbed the Lady of the Land. And I also encouraged record keeping because the military at the time and the hospital at the time did not have any form of record keeping. So through my invention of my pie chart system, I was able to prove that the mortality rate had reduced significantly once I and my group of nurses intervened into the conditions of our wounded soldiers by cleaning up and promoting good health, promoting good food, cleaning up the surroundings, and implementing several changes. Eventually, I established the St. Thomas Hospital and the Nightingale Training School for Nurses in 1860. And through writing several letters to inspire so many people around the world, I became an advocate for healthcare reform in India, Africa, the United States, and worldwide. My theory has four major assumptions: the assumptions of the person, health, nurse, and the environment. When we talk about the person, we have to remember that everybody is a holistic being. We're all made up of four major components: the physical aspect, psychological, spiritual, and social aspects. And when nurses, when we practice, we have to consider holism of our patient. Don't only focus on the physical aspect, but also on the emotional aspect, what your patient is thinking, what frame of mind they're in, and putting all these components together helps us to effectively care for our patients. Secondly, is that of health. Health is a state of wellness, and every power must be utilized to achieve this state. Disease is a reparative process. Uh, it's on a health wellness continuum, and nurses should be very observant and assist our patients in promoting good health. Thirdly, is that of nursing, and I taught my nurses to be very observant, taught them what to observe, how to observe, symptoms that indicate improvement or worsening of the condition, and to watch for evidence of neglect. For example, if you don't turn your patients who are bedridden and they develop pressure ulcers, that is ultimately the fault of the nurse. So we have to be very observant and assist our patients in every way possible to promote their good health. So I encouraged my nurses to think like nurses because every woman eventually, and of course every man, to eventually someday take charge of the health of another person. Fourthly is the environment. I encourage my nurses to manipulate the internal and the external environment of our patients, and we have to maintain a clean environment to enhance healing of the patient, from bathing the patient, making sure we also take baths before we care for the sick, ensuring that the linen and the rooms are clean, maintain pure air in the rooms and in the hallways. I wrote my book, The Notes on Nursing, in 1859, basically to serve as a guideline for our nurses. And this book highlights 8 major concepts which today form the backbone of today's nursing practice. These concepts include pure air, pure water and good drainage, cleanliness, light, quiet environments, food, variety, and petty management, which can also be called patient confidentiality. So, how is my theory relevant in today's practice and research? First of all, we talk about hand washing. I noticed that the wounded soldiers, lived in very dirty conditions, and that can also be applied today. Hand washing is the number one defense against the spread of germs. So in hospitals today, hand washing is something that is definitely promoted, definitely practiced. We as nurses are encouraged to always wash our hands before we give our patients medications. And also, we see a lot of facilities have hand sanitizers now on the wall. So when you go into your patient's room, make sure you use your hand sanitizers, wash your hands after that, and also use hand sanitizer when you're done caring for your patient. Secondly, is the implementation of isolation rooms in in the hospitals all around the country. Different forms of isolation, such as airborne isolation, contact isolation, just regular standard precautions. And this developed definitely from my theory because I emphasized on cleanliness, which today has also been branched out into the different forms of isolation. Thirdly, is a quiet environment in the hospitals. In my book, I spoke about maintaining a quiet environment amongst our wounded soldiers. Do not startle your patients. Try and let them have a good quality sleep, and that in turn will promote the health of your patient. So also today, we always encourage silence, quietness in our hospitals. We uh, discourage a lot of noise, discourage running in the hallways, just maintaining as quiet environment as possible to ensure your patient is able to get a good quality of rest. Fourthly is the smoke-free environment. Hospitals are smoke-free smoke-free zones because smoke is considered it's dirty. So dirty air, if your patient breathes in dirty air, that in turn will make them sicker. If once they're already sick, smoke will make them even more sick, leading to respiratory problems and other complications. Also, we look at preventing disease, the spread of disease by proper drainage and sanitation. That in itself is self-explanatory. I saw that the soldiers, your housing was over filthy sewers, and that is very unacceptable. So even today, our hospitals have to meet certain regulations. You cannot have dirty linen and dirty water and sewage all over the place when trying to take care of your sick. It's just unacceptable. And also, I emphasize on record keeping for effective communication among healthcare providers. That is very much present in our healthcare system today. Electronic communication is something that wasn't present in my time and is very significant today. Different doctors are able to log into the internet, into the hospital system to pull up their patients' records. And I noticed during the Crimean War, the hospitals at the time, the British soldiers, they were not keeping any record of the illnesses, the disease that patients were contracting, how many soldiers were dying. There was just no form of record keeping. So in turn, this is something that my theory has brought much relevance to practice in nursing today. So in conclusion, I'll briefly talk about a research study that was conducted and published in the Journal of Pediatric Nursing in 2004. The aim of this research was to improve the health of adolescents and young adults aged 10 to 24. It was applied by teaching a group of pre-adolescent children about negative peer pressure. So, and that's because this group is they're developing their self-esteem at this age, and they're extremely vulnerable to social pressures. So we focused, the study focuses on 10 health indicators in the community today. For example, physical activity, overweight and obesity, tobacco use, substance abuse, responsible sexual behavior, mental health, violence, and access to care and immunizations. So the children were put into interactive group sessions in which uh, 8 of my concepts were applied to the group. And may I mention that these concepts were applied successfully, and that's why we see them being practiced in today's healthcare system. For the sake of time and to allow my other theorists to be able to present their theories, we'll only look at 4 of these concepts. First, confidentiality. Second, leadership. Third, observation. And fourth, fresh air and a bright environment. Number one is confidentiality. I'm sure all of you have heard about the Health Insurance Portability and Accountability Act, HIPAA. I quoted in my book, and I'll quote myself. I stated, remember, every nurse should be one who is depended upon. In other words, capable of being a confidential nurse. She must be no gossip, never answer questions about her sick, except to those who have a right to ask them. So basically, the aspect of confidentiality was introduced to the children, explained to them what it is, what it means, and how it relates to them even in the study. So they were taught that the questions that they were being asked and that they were going to answer, all that was going to be confidential. This allowed them to participate freely in the group session. And of course, their parents also gave consent for the children to participate in the study. Second was leadership. The nurse acted as the leader in this group. She was able to assess the needs of the group as they interacted and answered the questions. And the nurse also gave direction to help the kids promote positive thinking skills. That in turn, that in turn showed the children that each of them was a leader also among their peers and to stay away from negative peer pressure. So I quoted in my book, to be in charge is certainly not only to carry out the proper measures yourself, but to see that everyone else does, to ensure that each does that duty to which he is appointed. So every nurse is a leader. All of us in this room today, we are all leaders and we are advocates of our patients. The fourth concept is that of observation. I taught my nurses that the most important practical lesson that can be given to nurses is to teach them to observe how to observe, what symptoms indicate improvement, what the reverse, which are of importance, and which are of none. So basically, the group members were observed to identify their unique needs in dealing with peer pressure. So the aspect of observation was applied to this group, and it just basically teaches us that we as nurses have to be very observant with our patients. So too, the children were taught to be observant even whilst they're amongst their peers, to know what is positive and what is negative to them in relating to peer pressure. The fourth point and the last aspect here is that of fresh air and a bright environment. In the group session, these sessions were carried out in brightly colored rooms with open windows to allow fresh air in, with beautiful decorations on the wall, brightly colored rooms to make the children relaxed and comfortable in this setting. So that helped them to be able to open up. They were free to ask questions and to participate in the study. And I quoted in my book, it is the unqualified result of all my experience with the sick that second only to the need of fresh air is the need for light. So this is very applicable even in today's settings when we manipulate the external environment and the internal environment of our patients, then that promotes their health. Opening up the windows and just letting sunlight, just fresh air, our patients should be able to breathe in fresh air. When they see the sunlight, they automatically feel better. So these are just simple ways to promote care in our patients that I presented in my theory so many years ago that are very relevant even in today's setting. So I just want to say thank you everybody for taking the time to listen to my theory, and just hope you enjoy the rest of the conference. Have a wonderful day.